Hi, I'm Dr. Lennox Hoyt, fellowship trained urogynecologist and pelvic surgeon, and we're here to talk about life after mesh. If you're a woman and you've had a complication related to transvaginal mesh and you've had that mesh removed by a surgeon, you have a question. What's my life going to look like after I've had mesh removed? And that's a really important question to consider, especially if you're considering mesh explantation or mesh removal. Usually, removal of transvaginally placed mesh for prolapse repair can be a daunting task. It requires experienced urogynecologists and pelvic surgeons that are trained in the removal of transvaginal mesh. It can be an extensive procedure with lots of risks, and especially risks of bleeding, damage to surrounding tissues, sometimes hemorrhage. So, in the hands of a competent surgeon, mesh removal is quite a complex process. So one of the things to actually ask yourself, if I had mesh for prolapse repair, when you remove the mesh, will the prolapse come back? Something that's important to consider as you contemplate your options. So the answer is probably yes, since the mesh placed transvaginally was supposedly designed to restore prolapse or reduce prolapse. If you have the mesh removed, the support system is gone. And so it's very likely that the mesh prolapse that you had before the mesh placement would recur. Not to worry, there's actually mesh-free methods that can be used quite successfully, and we here at Pelvic Floor Institute have developed some really sophisticated techniques for durably restoring recurring prolapse that occurs after mesh removal. So one of the really important considerations for when you're having mesh removed, depending on how extensive the mesh placements were, depending on the type of mesh that was placed, how it was designed, and how the technique for placing it, there is always a chance that the mesh cannot be completely 100% removed. Here at the Pelvic Floor Institute, we strive to remove completely 100% of mesh that's placed, and we are really very successful usually at getting that done. But many times you will find that attempts at mesh removal can get rid of the damaging or injurious part of the mesh experience and resolve the pain and so forth, but sometimes may not be able to completely remove the mesh. It's also really important to know that there are different types of mesh, of synthetic mesh. There are the synthetics, which are made from polypropylene usually, which is distilled petroleum product, kind of like a plastic that's woven into a mesh, gauze-like weave. And there are also what's called biologic meshes. They were developed using animal extracted tissue, and those tend to be a whole lot harder to remove because of the way they incorporate into the surrounding tissues. So I would exercise caution, and I would ask you to exercise caution with trying to completely remove a biologic mesh. The biologic mesh tends not to be removed easily because it can cause damage to surrounding organs like bladder and bowel and so forth. If we're talking about a synthetic mesh, which we're talking about now, those tend to peel away and explant much more easily and straightforwardly. And for many of the meshes that have been placed in women that occupy entirely space within the vagina, you stand a good chance of getting all of that mesh out. So when you are considering prolapse repair and you go to a surgeon to try and see if they can help you, and that surgeon offers you a mesh-based procedure, it's really important to understand that the most durable, viable, mesh-based procedure for prolapse repair is the abdominal sacrocolpopexy. That's considered the gold standard for prolapse repair using synthetic material. If you're approaching or considering a surgeon to do one of these procedures on you, you want to really ask some fundamental questions. How many have you done? And the number of these procedures should rank in the many hundreds, not in the ones or twos, teens, or tens. Number two, you want to ask that surgeon, are you prepared to deal with potential complications of the abdominally placed mesh? You might want to ask them, hey, what are some of the complications that I could experience? And number two, how many explantations or how many mesh complications have you handled in your surgical practice? You really want that number to be above 100, is to feel confident that that surgeon can deal with his or her own complications should they develop. Because mesh complications are real, surgical complications are real. It would be a mistake to assume that any surgery has zero complications. What's important is to know that you're dealing with a surgeon who knows how to manage and has managed complications before. So those are the two big ones. So If you're considering a mesh-based procedure for prolapse repair, you really want that procedure to be an abdominal sacrocolpopexy. We're talking about prolapse repair, not incontinence. If you're being offered a transvaginal mesh procedure for prolapse repair, you really want to understand in great detail from your surgeon how many they've done, what their complication rates are, how they handle complications, and what's their method for dealing with complications. Ask them, quite frankly, how are you anchoring this mesh? Are you anchoring it side to side, or are you anchoring it at the top? Is it covering the tissues in the vagina, the so-called spanning mesh, anchored from one side to the other? If that's what they're telling you, I would strongly advise. And the reason why I'm telling you this is because I've actually served as an expert witness in the complex transvaginal mesh litigation cases from the 2020s, the 2015-2020 period, and I've watched and listened to and reviewed cases of lots of women, tens, hundreds of women who've had complications of transvaginal mesh placement. They can be pretty serious and pretty daunting, and they can actually really cause a problem with your life. So one of the questions I get asked a lot in my practice is, what's life after mesh removal look like? And for prolapse repair, if you have mesh removed, there's a pretty strong likelihood that your prolapse will recur. If your prolapse has recurred because of a mesh erosion or pain or other kinds of complications, you're very likely not want to have more mesh placed. The good news is that there are actually solutions to prolapse repair that involve using your own tissue in ways that can have the same outcome and result as if you use the mesh, except you're using your own tissue and not mesh. Now, there have been some traditional procedures like the uterosacral suspension and sacrospinous fixation and so forth that have relatively high failure rates. I'm not talking about those. I'm talking about using your own tissue in a durable way to solve your prolapse repair, to solve your prolapse problem recurring, which came after mesh explantation or mesh removal. Here at the Pelvic Floor Institute, we specialize in offering those procedures to our patients who desire and commit to the resources, their time, their efforts to try and find the right surgeon who can address their problems without using mesh in a way that would be durable such that you can get your life back. If you want mesh-free removal surgery, please be prepared that it's going to take some on your part, a commitment of time, a commitment of effort. You really do have to work hard to find the right surgeon who's experienced in using the type of techniques that will get you a durable solution in a mesh-free setting, and you have to be prepared to commit some of your resources towards getting to that solution, because it is not straightforward for obtaining a mesh-free repair that would be durable. So many women ask the question of, will they get their life back to normal after explantation of mesh? And the answer is unclear. I don't think anyone can guarantee that. I think the intent for most surgeons that remove mesh is to get patients out of pain and out of the symptoms that they've encountered or developed since implantation of the mesh, if they develop symptoms. It's important to understand that many women who have mesh placed for prolapse repair, especially mesh placed abdominally, will not have significant symptoms, and in fact, for abdominally placed mesh, will have their quality of life substantially improved compared to where they were before the prolapse was fixed.